Welcome to the Health Workforce Technical Assistance Center's webinar series. This presentation is entitled An Introduction to HRSA's Web-Based Nursing Supply and Demand Model. And it was presented by Arpita, Chattopadhyay, Tim Dall, and David Armstrong on March 16, 2016. With that said, let's go ahead and get started. Arpita?
Yeah, thanks, David. So good afternoon, everybody, and welcome. I'm Arpita Chattopadhyay. I am the Chief of the Workforce Analysis Branch at the National Center for Health Workforce Analysis and lead the Research and Data Analytics section of the center. So I do take this opportunity to thank the SUNY TA Center for organizing this, and of course IHS and Tim Dall for actually producing what you're going to see today. So a bit of a background about the National Center. The National Center was created in 2010 as part of the ACA, Affordable Care Act, to provide data and information to health workforce decision makers, basically. It helps HRSA meet its goal of ensuring access to care and also inform stakeholders. The National Center's scope is really much broader than just targeting it to HRSA programs. It is national in scope, so we do expect to help inform other stakeholders like states, workforce planners, training programs, educational institutes, and professional associations, and help them form the training needs. So basically, we have a whole number of activities in data collection, analysis, and one of which is, we've made considerable improvements in is the new projection model. And so today, we'll see a presentation of a version of that projection model. The reports are available on our website, so that's sort of the static version. It's the reports present results at the national level, and they do have a state breakdown, but we did feel that, given the state's role in really the nursing workforce, it would be nice to transform the projection model into a web-based tool so that users, anybody who have micro-level data can sort of upload it and get their own, run their own projections to determine what the health workforce need would be. So this work is based on a microsimulation model, and it's relevant for multiple professions. And HRSA itself has produced reports from this model on a variety of health professions like dental health, allied health, healthcare support technicians. So today I will ask Tim now to present the sort of the nuts and bolts and to walk you through the web-based model.
Thank you, Arpita. So today what I want to do is actually provide a little bit of background on the modeling approach. And then David will actually do a presentation where he walks people through how to use the model. But like all models, it's important to at least have some understanding of what the model is doing. And I would note, as Arpita said, that there is more extensive documentation of the model on the HRSA website, along with the reports that have findings. So what I'll do is give you a little bit of background on the model itself, and in particular on modeling supply. The reason I'll focus on modeling supply is that this web-based model is basically a small component of a much larger model that Arpita alluded to that looks at supply and demand for nurses, doctors, various allied and technical health professions. It covers about 36 medical occupations. And the reason for focusing on the supply is twofold. First of all, as we develop the supply projections for HRSA, we acknowledge that you all are the ones that are sitting on all the really good data on nurse supply, whereas we have limited data sources at the national level. And so the goal of this web-based version is that, as Arpita mentioned, you can upload your own data and run your own scenarios. I will touch lightly on the demand modeling. However, in this web-based model, all of the demand projections are pre-populated, meaning that you cannot change any of the inputs or any of the scenarios around the demand modeling, at least at this stage. I would also note that in this discussion we will be focusing on registered nurses and licensed practical nurses. In the HRSA models, advanced practice nurses are actually modeled jointly with physicians and physician assistants. And so in this model, in the attrition patterns, we have RNs that leave the workforce to become APRNs, but we don't specifically model supply and demand of APRNs. Okay, so on the supply, when we think about the goal of a supply model in general, of course one of the goals is to provide accurate projections, but a second and important goal is to understand how we think supply might change in response to external forces such as economic factors that might affect labor force participation patterns, or also decisions like policies and expanding the training capacity. So when we think of the major components of the supply, at least the supply projections, we've got our starting supply, so the number and the characteristics of people currently in the workforce, because that's the basis of what will become the nurse supply next year. We have the new entrants. For those people in the workforce, we have different measures of workforce participation. First of all, are they in the workforce or not? And second, if they're in the workforce, how many hours do they provide? In the model, we also look at career changes. In particular, each year a small portion of the LPNs might move into the RN supply. And we have within the RN supply some that might have an associate or a diploma degree that are moving to a baccalaureate degree, or those with the baccalaureate degree moving to a graduate degree. And then as mentioned, some of the RNs might transition out of the traditional RN workforce to become advanced practice nurses. Also, there are certain components of the model about geographic location, the decision of nurses where to practice. In the model, we only have limited cross-state migration, but in the broader HRSA model, outside of the web-based model, there's more capabilities to model cross-state migration. And then when we think of attrition, at the national level, it would be those nurses who are retiring or mortality, but at the state level, it could also include people moving out of the state to another state. So we use a microsimulation approach for modeling, and there's a couple of reasons for that. This is different from the approach used previously, where basically we looked at cohorts of nurses. So maybe either by year that they graduated from their training program or by their age, and just said what happens to this stock of nurses or this cohort as it ages. By using a microsimulation approach, it allows us to have more explanatory variables in there in terms of the characteristics of nurses and economic factors, and so that we can do more dynamic modeling. And the goal is to continue to improve the model, both the model that HRSA is using and hopefully the web-based model as well, as more research is done on those factors that affect various components of nurse supply. So the process then is it begins with a database, and in the database it has the starting supply of RNs and LPNs, and this database could come from your licensure files, presumably. If you don't have complete data on licensure, it could come from a survey, but you have information on each person in your nurse workforce. And then we model the number of new people coming in, the number of people leaving, some activities that happen for the people in the workforce, you know, like their labor force participation, hours worked, mobility. And then the end of the year is the projection for the end of the year is basically the starting supply for the subsequent years, and then it models year after year until you reach a certain endpoint. And the types of scenarios that you can model, there's a limited number of scenarios around the various supply determinants, such as do we train more, do we train fewer, do people retire earlier or less, do they work more hours, do they work fewer hours. So there are some limited scenarios right now in the model that can be modeled. Okay, so the model starts with the beginning year supply. And the minimum requirements are each nurse is a separate observation in the file, so one record per nurse. At a minimum, we need their age and their gender, and we need their activity status, so they active or not active, and then their highest educational attainment. For RNs, we track 3 levels of educational attainment, those trained at the associate or diploma level, those at the baccalaureate level, or those with a graduate degree. And that education level does affect certain things, such as their labor force participation, their hours worked, and the retirement patterns. So in the web-based model, basically you would upload your licensure data, and David will walk you through the templates for uploading that information. Now, in the report that HRSA published in 2014, we used the American Community Survey to develop the starting supply files for each state, recognizing that that data source is not as good as the data that you have, but the data is collected consistently across states and over time. For the work that's going on right now to update the workforce projections, we have added race and ethnicity as a component to the model, so that, for example, hours work patterns not only differ by age and gender, but also by race and ethnicity. And some states have already indicated that they will voluntarily make their licensure data available to include it in the HRSA projections. And this is an open invitation for those that would like us to use their licensure data, just an extract of it, be identified, of course. And for those states that do not want to provide that data, then we'll just continue to use the American Community Survey data for your state, even though we know it's not as good as your licensure files. Okay, then each year we add new nurses to the workforce. Now, the way it was done for the HRSA's 2014 report is that we looked for each state at the number of nurses taking the NCLEX exam for the first time, using first-time takers of NCLEX as a proxy for the number of nurses that will eventually enter the workforce. And we recognize that not all nurses pass the exam the first time, and some will take it multiple times. And then we modeled 2 different scenarios. One is, what is the future supply of nurses likely to be in your state if all the nurses that you train stay in your state and you don't have nurses migrating from other states, and basically you're training your own. And then we modeled a scenario which is, what if nurses act somewhat on a national labor force, in the sense that there is migration and the nurses go to where they have the greatest opportunity for employment. So there's those 2 scenarios. So in the web-based model, you can actually change the number of new entrants and the distribution across states. Now, the work that's ongoing right now for HRSA is slightly different than what was used in the previous report. We do start using the NCLEX exam data and those that are the first-time takers. However, we no longer assume that every nurse will eventually make it into the workforce. When we look at the NCLEX exam pass rates for those that take it the first time and then subsequent times, we estimate, and this is just an estimate, that about 98% of the baccalaureate-trained nurses will eventually make it into the workforce, about 96 for the associate, about 95 for the LPNs. Those numbers might be off a little bit, but they are the estimates that we have from some national data sources, and so that differs a little bit from before, when we assumed 100% would eventually make it into the workforce. Within the model, we have information on the likelihood that nurses would have some career changes. In particular, those that are RNs will move out of the traditional RN workforce and become an advanced practice nurse, and then also those that are a licensed practical nurse that would move into the traditional registered nurse workforce, and that differs by nurse age. Then we have retirement patterns. The approach that was used for the 2014 report, because of data limitations, what we did was we focused on retirement patterns for nurses ages 50 and over. And we used the American Community Survey, and we actually used as a proxy for nurse retirement patterns the retirement patterns of males and females that had some college, a baccalaureate degree, or a graduate degree. So for those nurses with an associated diploma degree, we used retirement patterns for all workers with some college. Likewise, with nurses with a baccalaureate or a graduate degree, we used data for their counterparts in the entire U.S. that had a baccalaureate or graduate degree. The reason for that is in the American Community Survey, if a person has been out of the workforce for more than 5 years, the survey does not ask what their occupation is. So if a nurse has been out over 5 years, we know what their education level was, but we don't know that that person was a nurse. And so that's one of the challenges with American Community Survey data. And so when you run the web-based model, just note that the retirement patterns are based on this proxy for retirement based on the general workforce in the U.S. by education level. One of the things we're doing now for the new work that we're doing is using data from a number of states that have provided licensure data. And right now, it consists of South Carolina and Texas, but we have several other states that have indicated that they will be providing their licensure data. And what we've done is we've looked at how the age distribution of the nurse workforce changes from year to year, and among those older workers, how many nurses would there have been if nobody retired, compare that to how many there actually are, and we can actually calculate attrition patterns by individual nurse age. And this next slide right here, I know there's a lot of lines all close together, but the solid lines that are green, red, and blue, these are the retirement patterns based on the general workforce in the U.S., those with an advanced education degree, a baccalaureate degree, or some college. The blue dotted line is our estimates from the Texas data on nurse retirement patterns. This is for RNs. And for the purple dotted line, that's for South Carolina. And the dotted line combines the South Carolina and Texas data. And as more states provide their licensure files, we can have that be more than just the 2 states. What you see is that the numbers are relatively close together, although with the newer data, we don't yet have a large enough sample size to do the retirement patterns by individual nurse education level, but that is one of the goals. Okay, for hours worked and labor force participation patterns, currently in the web-based model, similar to the 2014 report, labor force participation is based on a series of regression analyses where we look at, we first predict a nurse's wages based on his or her age, gender, education level, and some information that we know about nurse wages in that person's state. And then we use predicted wage plus other characteristics of the nurse to predict hours worked. And this table right here is actually based on the new data, data from the American Community Survey from 2010 to 2014, whereas the equations that are currently in the model, I believe, are based on approximately 2008 to 2011 data. I'm not sure the exact years, but I think it's about 2008 to 2011. Okay. And the labor force participation patterns for nurses under age 40 are also based on analysis of American Community Survey. In the web-based model, it's just a flat rate by nurse age and gender, whereas in the new analysis, it's a prediction equation that takes into other factors such as wages and then the unemployment rate. And we find, for example, that as the unemployment rate in the state goes up, that more nurses enter the workforce, maybe that had left the workforce and are reentering. So there are some economic factors at play. Just really quickly on the demand model, like the supply model, demand is modeled using a microsimulation approach where individuals are the unit of analysis. And the approach is that we create a population file with characteristics of the population in a particular state, and then using predictive equations that are national based on the Medical Expenditure Panel Survey, we relate the detailed characteristics of a person to his or her use of services by different care delivery settings. And then based on national staffing patterns, we translate the demand for healthcare services into the demand for registered nurses, licensed practical nurses, and other health professionals that are modeled for HRSA. And as mentioned before, in the web-based model, currently all the demand projections are pre-populated, so you cannot change those. The information that is collected on each state, so for each person, for each state, we have a representative sample of the population, and for each person in that representative sample, we have their age, sex, race, ethnicity, household income level, their insurance status as a private, public, non-Medicare, Medicaid, uninsured. We have whether or not they're in a managed care plan, do they reside in a metropolitan or non-metropolitan area. For each person, we have are they normal weight, overweight, or obese, are they a current smoker or not, have they been diagnosed with hypertension, cholesterol, heart disease, diabetes, history of stroke, cancer, asthma, arthritis. And all this information is then used, oh, and there's one other one here, history of heart attack, which it's also in there. And all this information is then used to predict each person's use of healthcare services and how it might change over time as that person ages. And then, so we've got the population file, we've got the healthcare use patterns, and then what the model does is it looks at demand for the different settings where care is provided by nurses. I would note that on the supply side, though, we do not model where the nurses are providing care, only their education level and the characteristics of the nurse. So with that, David, I will turn it over to you.
Okay, next I'm going to demo the interface of the web-based nursing model using a series of screenshots. Unfortunately, given our time restraints, I'm not going to be able to cover all the features, but I'm hoping to hit on the major elements. The nursing supply and demand model is located at the following website. Now, once more a reminder, slides of this presentation in TIMS will be available on our website following this presentation, so don't worry about copying this website down immediately if you don't already have it. Once you go to this website, this is the sign-in screen. And the first thing you need to do here, if you have not already done so, is register. And you see the register button right under the password field. And mind you, everyone can register for the model. You don't have to have any special qualifications whatsoever. And so to register, simply click on the button. Then you're going to be asked to provide your name, email address. I believe it also asks for the state where you're from. Then you will immediately receive an email from the system which will give you a temporary password. You can then use the temporary password to log in. From there, it'll prompt you to enter a permanent password. It's fairly straightforward. I'm sure many of you have been through similar processes before. It shouldn't take you any more than 5 minutes. And once you have your account set up, you can go in and sign into the model. And the first screen you're going to find is this one here. So welcome to the Nursing Health Workforce Model, the home screen per se. And at any time when you're using the model, throughout your scenarios, et cetera, you can always go back to this home screen by clicking that little house button at the top of the screen, the house button next to the Nursing Health Workforce Model. Click that at any point in time, you'll go back to the start screen. Now, on the other hand, if you click the HRSA.gov button right next to it, you're going to go to the front of the HRSA website, and so you'll be kicked out of the model. So be careful with that one. And of course, on the upper hand right, you'll see a My Profile button. That's where you can change your password at any time and take care of some other administrative functions. Now, as I said, we only have a limited amount of time to discuss the interface today, so I'm really going to focus on the supply model, because the supply model is a more dynamic model for the web-based application. In the supply model, you can change parameters such as the number of entries for LPNs or BSNs, ADNs, et cetera. You can change your average retirement age, et cetera. So that's what we're going to focus on today. But for those of you who are interested in the demand model, there is a pre-calculated demand scenario in the system, and that scenario will give you projections for the demand for LPNs and also RNs by setting for a number of years for at both the state and national level. But you can explore that by yourself. For today, let's go ahead and just go into the supply model. So we're going to click on that and move on to the next slide. This here is the nursing supply model interface. And as you can see, there's a couple tabs right in the middle of the screen. There's a Run Reports tab and also an Email Reports tab. Under both tabs are the same options. It's just that if you click on a scenario under the Email Reports tab, the scenario, the outcome will actually be emailed to you. It won't be displayed in the browser. It will be emailed to you in like an Excel file, which you can then open up and observe. Now, I will say this much. As of right now, if you have a report emailed to you, it will only show you information for the nation as a whole. You can't drill down into a state using the ERO reports function. Perhaps that will come in the future. We'll see. But for now, let's stay within the Run Reports tab, and I'll take you through some scenarios. As you can see, there's a number of pre-baked scenarios. There's a status quo scenario, a low graduate scenario, an early retirement scenario, et cetera. But what I'd like to draw your attention to is the user scenario. So let's go ahead and click on that tab and see what comes up. Here is the user scenario tab, and this is where you can go to play around with a lot of the parameters and levers that the model has. You can change the retirement age here. You can change the simulation period. You can change the number of LPNs entering each year, the number of ADNs entering each year, and the number of BSNs. You can also change what an FTE equals. So, for example, right now, an RN FTE equals 35.77 hours, which I believe was kind of the national average at the time when the data was built. And so essentially what this means is if you're looking at your state and there's more FTEs than headcounts, that means on average nurses in that state work more than the national average, just to point that out to you. But for now, let's go ahead and continue, and let's just go ahead and run this scenario as is. So we're just going to go ahead and run the status quo scenario. And here we see we're running this scenario. And so this is what a scenario running is going to look like. And I point this out to you because it can actually take several minutes to complete. On average, I would say it takes between 3 and 5 minutes for a scenario to run. So just realize that because there are actual calculations happening in the background. And so just be aware of that when you go into this model. You need to spend some time with it. Now, once the scenario has completed running, this is the first screenshot you're going to see for the results. And so the first screenshot, you see there's a bunch of numbers, and at the top there are the RN numbers, and kind of going off the page are the same numbers for the LPNs. In fact, this is generally how most of the results pages are set up. You'll have the RN information at top, the LPN information at bottom. And so you see several things here. You see like we have head counts, we have FTEs, et cetera. And, you know, you see it's projected through 2025. But also I'd like to kind of draw your attention to the drop-down menu. Right now it has state and you see USA. So right now we're looking at the national numbers. But at any given time you can use that drop-down menu to say to look at numbers in South Carolina or California. And you just have to kind of use the drop-down menu, hit change, and you'll see those specific numbers. Another thing I'd like to point out to you on this screen is that in the right-hand corner of the screen, you see the scenario parameters. And once more, this is just the status quo scenario. But if you're messing around with scenario parameters, this is a handy way to look at and see what you actually did in case you forgot that you actually lowered the retirement age by 2 years or something to that effect. So it kind of gives you the parameters on all the screenshots, so you know what you're doing at all the given times. Another thing I'd like to draw your attention to on this screen is like kind of the pie charts up ahead. You see there's a national overview pie chart, a state overview pie chart, et cetera. And these are all different results screens. So let's go ahead and explore some of those. Let's go ahead and look at the national overview. So clicking on that pie chart, this is what you see when you go into this screenshot. You see a national overview, and all this does is kind of gives you the information. It gives it using like a line graph. It's just a different way to look at it. It shows both the counts of RNs and LPNs. And right now you're just looking at head counts, but you can change that. You can also look at FTEs by using the drop-down menu right there. So there's a lot of flexibility here for you to look at the information in different ways. But next, let's go to my favorite, which is actually the state's overview. But to get to that, of course, you just click on the pie chart at the top of the screen. In the state's overview is maps, and you know everyone loves maps. I like maps. And so once more, the RN map is at the top of the screen, and the LPN map is kind of a little bit below. It's the same map, identical information, but of course for LPNs. And as you can see, the map's color-coded. The darker, the more, the lighter, the less. And it's a really nice way to compare your state to other states. And if you hover over any of the states, you'll actually see the relevant information come up, like how many RNs are actually in Texas or Montana, et cetera. Now, right now, we're looking at the map for the year 2013. We can change that to look for any year up to 2025. And we're also just looking at head counts. We can look at FTEs. You can actually look at the population of the state as well. Another thing you can do is rather than just show absolute counts, you can actually show ratios per 100,000. So you can see like the number of RNs in your state per 100,000. And you just have to kind of click on that show ratio per 100K button up there to show that information. So once more, the map, there's a lot of ways to look at the information using this map screen beyond simple head counts. But now let's go ahead and go to the next screenshot, and that's going to be the national year drill down. And this particular screenshot, this particular result page, essentially just shows you a series of pie charts, and the pie charts break out a number of different demographic characteristics, et cetera. Well, the first one shows the separations, which are the people leaving the workforce versus some people entering in the established. Under that, you have gender. Also trailing off the page, it's not shown here, you have age breakdown, et cetera. So there's a series of kind of basic information screenshots that they're portraying on these RN and LPN. And in this case, unlike the other ones, the RNs are on the left, LPNs on the right. And once more, you can look at this information for multiple years. Like right now, we're looking at 2013. You can look at the projected information for 2025. You can drill down into the specific state, et cetera, simply using the drop-down menus at the top of the screen. Another thing you can do right here within the supply menu is you can compare the supply of RNs and LPNs to the demand for those. And that's our next screenshot here. And so right here, we're comparing the supply of RNs to the demand for RNs. And right now we're looking at the state, but once more, you can focus in on a particular state, such as Oklahoma, Vermont, et cetera. And once more, the LPN chart is kind of trailing off the screen. You can't see it here. Another feature of this particular results page I'll point out is that little equalize checkbox. If you want the supply and demand for RNs or LPNs to start off in equilibrium, that is equal to each other for a given year, you just have to check that box. Otherwise, they'll be a little bit different. Okay, now we're back to the start screen, or to be more precise, the supply model start screen. Because there's a couple other things I want to go ahead and mention to you. One very important, but since I forgot to mention it earlier, if you look at the tabs at the top of the screen, that is scenario, upload data, results, about, if you go to the About tab, there's actually a user manual in there for you to look at. So that might be one of the first things you do when you go into the model. But what I really want to speak with you about right now is how to upload your own data into the model, because that's really one of the best features of the web-based model, is that you don't have to use the pre-populated data which is already in the model, which is, as Tim said, is largely based on national data sources such as the ACS, et cetera. You can actually upload your own information. And so let's go ahead and click on that Upload Data tab and, get a feel for that. This is what the Upload Data screen looks like. Essentially, you need to browse your computer, find the appropriate data set, and upload it into the system. And you see right down there, there's a snapshot of what the data should actually look like. But I can give you a little bit more information on that. Ultimately, you only need a few pieces of information to use the supply model, the web-based model. You need state, age, sex, you need degree type, and whether or not the record is for an LPN or RN. Now, I will tell you right now, the model is very particular about the format of the data. For instance, if you do not capitalize the variable name age, it will not accept it. And so you have to be very particular about what the information looks like when you're uploading it. And as you can see, LPN is blank, because these are RN records. Well, you can't put a serial there. It also won't like that. It also doesn't like spaces. So once more, it's very particular. But I can assist you with that if you have any trouble. Now, with that said, the model also expects you to have a record for each nurse that's practicing. And so you can't just upload, say, a 30% sample. You do need to have a record for each nurse that's practicing. So if you do, say, have a sample of 50,000 nurses practicing in your state, and there's 100,000, I would suggest you just simply double the records to keep them representative, but also to provide the model with what it needs. Another thing to keep in mind is the model also doesn't like missing data. If you have missing data, chances are it's going to eliminate the record. So you need to figure out what you want to do with the missing data within your records prior to uploading it. I would suggest an imputation technique of some sort. Now, with that said, I'm telling you, you're going to have questions if you're going to upload your own data into the model, but that's okay. I can work with you to help you with that. Feel free to contact me at any time at my email address or phone number, and you can ask me any questions you have in regards to uploading data, and if I can't answer them, I can go back to Arpita or ask him and get you the answers for you. I mean, we're here to assist. With that said, that does wrap up my part of the presentation. So at this point in time, I guess we'll go ahead and move to questions and answers. Now, just a reminder once more, if you have a question you would like answered, please use the chat panel in the bottom right of your screen and send it to all panelists. With that said, we've already had a few come in, so I'm going to go ahead and get started. And Tim, well, I believe this one's primarily for you, but here we go. Tim, can you explain more about volunteering state licensure data to feed the model? Do you have basic requirements? Will you have a data sharing agreement?
Okay, so obviously HRSA cannot force anybody to provide data. All they can do is encourage people to voluntarily provide it. But basically, if you have data you would like to contribute, you would go through the Technical Assistance Center, and really what we're looking for at a minimum is 1 year's worth of data, the most recent year that you have, and for each nurse, just their age and their sex and their education level, and whether or not they're active in the workforce, and that's really the only information that we need. If you do have a couple years of data that you're willing to provide, we can do what we've done with some of the other states that have provided licensure data and basically use it to estimate nurse retirement patterns, and thus the retirement patterns that we're including in the model will become more representative as more states' data is used to calculate those. Perhaps eventually we'll allow each state to have their own retirement patterns or hours work patterns in the model, but right now those patterns are based on national data, with the exception that for hours work patterns and labor force participation, that it also takes into account characteristics of your state. But it would be a data use agreement working through the Technical Assistance Center to get that licensure data to us.
So let me just sort of chime in here. I would like to reiterate that this is the web-based model is really the version 1 of web-based of the model, and so while we are going through updating the model itself in the next round, and Tim, you know, he is using whatever data he has to really update the model itself. But the primary purpose of the web-based model is that you guys, I mean, the users would have their own data files that they would like to see. So it's giving the power over to states or researchers who have their own and possibly better data with microdata with them. So while you know, basically in order to improve the model, we are working in the background with the next version of generating the model itself, making the model. The purpose of this, the particular web-based application, is a bit unique, and I just wanted to reiterate that.
Yeah, and also I would note that when people use the model and upload their own licensure data, the model does not retain that data. So, so when you upload it, you're the only one that has access to that data. In fact, David, maybe you can touch more on this, but I believe the model doesn't even store the data. So once you end your modeling session, if you want to use your data again, you'd have to re-upload it because the model doesn't save anything.
Yes, that's my understanding, Tim.
Yes, so because we HRSA didn't want any PIIs in case you have you do have identifiable sort of triangulate into identifying somebody. We decided that the database would be refreshed every 24 hours. So if you're coming back within an hour, within 2 hours, you will still have your uploaded data, but after a cycle, it cleans up.
Thank you for the clarification, Arpita. Okay, we have another question here. Can you help us understand the migration algorithm? Do you model the probability of moving from X state to Y state in the microsimulation?
The answer is that in the web-based model, the answer is no. In some of the work that we've been doing outside of the model, we've been exploring those migration patterns and how they're influenced. For example, we know that nurses with a higher level of education tend to migrate across states more than nurses that have, say, an associate or diploma degree. But in the web-based version of the model, there's currently no migration across states.
All right, thank you, Tim. Next question. Is there a plan to add doctorate at the highest nurse education level?
I believe at the current time the answer is no, that we only have the 3 levels, and the highest level is just that they have a graduate degree. But that might be something that is more in Arpita's line of work as far as answering that question.
Well, our next version of the web-based application is really to work more towards making it user-friendly, expanding some of the capacity to include data, include scenarios, and that kind of thing. at this point, for the web application, we are not thinking of making any big changes.
All right, thank you, Arpita. Here's another question. So records uploaded for RNs should exclude APRNs, correct? And I believe the answer to that is yes.
Yes. Yes, and then each subsequent year as the model progresses, it will also take out a certain number of RNs, and they just kind of disappear. So the model doesn't distinguish between an RN that retires or an RN that leaves the traditional workforce to become an APRN.
Thank you, Jim. Okay, will the changes that have been made to the original model 2014 be published in an opinion report, say 2016 report?
The answer is yes, it will be in a new report, and we've started work on that report right now, and we have preliminary projections for that report. The answer is I don't know if it will be a 2016 report or a 2017 report. That will be based on the clearance process at HRSA.
Yes, so we are currently working, so Tim is still currently actually developing the model. Hopefully, once we get the results from Tim, it will go through the usual clearance process at HRSA, and that might take from a few months to maybe a year sometimes. So we keep our fingers crossed there for that.
Yeah. I would note, though, that for those states that would like to volunteer some of their licensure data so that the HRSA projections are based on their licensure data instead of the American Community Survey, that they have until approximately the end of June to get the data to us so that we still have time to incorporate it into the final projections.
All right, thank you. Next question. How are nurse practitioners treated in the model? In our states, we separate RNs from LPNs. How does the model handle that?
So in the web-based model, the model is separately tracking LPNs and RNs, and it estimates the probability that an RN of a particular education level and age will leave the traditional RN workforce to become an APRN. And then in the model, in the web-based model, they just disappear. Separate from this, in the larger HRSA model, we are modeling supply and demand for advanced practice nurses by medical specialty, and that is in a report that should be coming out fairly soon from HRSA, a series of reports on the primary care workforce, the behavioral health workforce, and other components where advanced practice nurses and physician assistants and physicians are all modeled jointly. But APRNs are not in the web-based model.
Thank you, Tim. Okay, next question. What kinds and level of TA can you provide to states, groups, and individuals? Will you travel to give presentations? Will you do webinars for specific groups? The simple answer is yes to all those questions. Ultimately, we can tailor the technical assistance we provide you to your specific needs. With that said, I will also take the time to tell you that at the Nursing Workforce Conference in Orlando here at the end of April, Arpita and I will also be giving a presentation there. I will be there in person, but she will be dialing in. So we will also be there to assist anyone who happens to be in Orlando. Otherwise, feel free to contact me using your information, and we can go from there. We can work out something for each person's needs to give them the assistance they need.
Yeah, and along with that, David, with the technical assistance, we realize that people will be providing feedback, and so we'll need to develop a mechanism whereby we can disseminate among other people kind of best practices, or if people identify something that isn't working right, some kind of a glitch, that we can let people know, and the Technical Assistance Center will do that.
Yes, that's a very good point. We've had some preliminary discussions to that point. I don't want to just spout off and say anything before we see how the things develop, but we do have some thoughts on it, and we will be looking to do that to centralize feedback, et cetera. Perhaps we'll add a fax Perhaps we'll add a discussion board. I don't want to commit to anything right now. We'll see how things proceed, and we'll go from there. But definitely, we want to be able to give people forum to hear their voices. Okay, here's another question. Is there a form letter or template request letter that researchers can use to request permissions from our state agencies to share data with HWTAC?
So I think the short answer is that if you're interested in making the request, the TA Center would be happy to assist you in developing the letter, explaining the use, and making sure that people at the state agency level are comfortable with the request. So there isn't a form letter, but again, we're happy to assist in drafting requests.
Yeah, once more to Jean's point, we will assist you as best we can. Okay,
and
next.
David, if there is an interest, they're to contact you then?
I think we can go through me first, and then if we feel like I can funnel into you or Arpita, I'll be the first line of defense here, per se.
So here's the thing, David. The federal government has, very strict policies on not accepting anything voluntary. It would be a problem if we are associated with this exercise in any way.
Okay, so we'll go through you, David.
Okay. Arpita, I don't know who you are. No, just teasing. Just teasing. Okay, next question. Are nurses that are not employed included in the supply model? This number is higher for LPNs in our state.
Yes, actually, this is something that we were just discussing earlier this morning before the call, that the model applies a labor force participation rate to nurses under age 40. So actually, when and we'll get this information out to everyone, but when you upload your files for the nurses under age 40, we need both those that are active and inactive in the state. So we know that they're in the state, but the active and inactive. Because what the model does is for the nurses under age 50, it applies a certain probability that that nurse is working. And so a person might be working 1 year and not the next, but then comes back in. Once a nurse gets to age 50 and over, what the model does is instead of tracking is the nurse active or not active, it starts tracking is the nurse retired or not retired. So if you were just to load only your active nurses into the model and then apply the labor force participation patterns, it would understate your nurse supply because you would be uploading conditional on them being active. So you actually want to load the active and inactive into the model, but only for those under age 50. For those over age 50, it's the active only. And we'll need to get that clarification out to everyone, David.
Yes, we will. Thank you, Tim. Okay, here's another question. I'm going to generalize this one. Is it possible that the numbers from the 2014 report will not match what's presently in the web-based model? And do we have a good answer for that one just yet, or is it something we need to check in on?
Well, I know that when we were doing the initial beta testing with the initial programmer, and we used the exact same files for the SAS-based model that we use for HRSA and the web-based model, that the numbers were almost identical. Sometimes there was a little bit of a rounding error, but they were almost identical. Since then, I know that the HRSA programmers have made a number of changes to the model, basically for security reasons. And so we're not quite sure yet if that might have affected any calculations. So they could be off by a little bit, but they should be close.
Yeah, so one sort of issue that we've had where the numbers may actually vary very slightly, though, is sort of because of the simulation process, and you know, it's a probabilistic process. So if a different number sort of turns up, then we might get a slightly different total. Other than that, I don't see any reason why we haven't made any substantive change in either the data file or the methodology. So I don't see why that should be very different. So which state is it that is different?
Yeah.
Well, there is one example up here, and you know, I think it's the case if individuals see that something's different in their state compared to the report, perhaps they can get in contact with us via our email, and we can find out what the answer is and get back with them. Would that make sense in this case, Arpita?
That would make sense.
Yeah, and David, Arpita is right that when the model is calculating retirement patterns, it will say, for example, that this nurse, given the nurse's age, sex, and education level, has a certain probability of retiring. And then the model generates a random number and compares the predicted probability to that random number and decides, did this nurse retire or not retire? So you can actually get slightly different results every time you run the model because of the random number predictor. But those numbers should be very slight in terms of you know, differences, but it could be slightly different each time you run the model. If you round your numbers off to the nearest 100 or something, it shouldn't affect that, but it could affect, you know, a little bit.
Yeah, it should be very close, yes.
Okay, thank you, Tim. And once more, if there's any questions in regard to a specific state, just feel free to contact me, and I'll get answers for you or figure out what's going on. Okay, last question. Would many RNs who are NPs be counted as RNs at the graduate level? I am confused about how they fall out of the system. Can you explain that again?
Okay, so when we're tracking nurses at the graduate level, these would be nurses that do not go on, that do not become a nurse practitioner and start practicing as a nurse practitioner. So what we've attempted to do is model how nurses change their education levels, and then also how the probability that a nurse will become a nurse practitioner. And so basically the graduate level nurses that are left in the model are assumed to not be nurse practitioners. I would note, though, that in the model, there's only a few things that are affected by a nurse's education level. That would be hours work patterns, retirement patterns, and just labor force participation. They can differ slightly based on the nurse's education level. And in general, the higher their education level, the higher the probability they're in the workforce and work slightly longer hours. But other than that, the model doesn't really track too much that a nurse with a certain education level does anything different than another nurse other than labor force participation patterns.
And let me clarify. So for HRSA's purposes, we model APRNs with physicians and physician assistants. So it's difficult to sort of put them in compartments, but that's how we have kind of subdivided the population.
Once more, I'd like to thank our presenters, Arpita and Tim Dall, for joining us today. And thank you out there for attending our webinar. Just to let you know, we will be posting our slides shortly to our website. So if you want to download them, check back very quickly at healthworkforceta.org. We hope to see you again in the future. Thank you, and have a good day.